Throughout our series focusing on health disparities in Appalachia, we've seen the impact that lack of resources and access to health care can have. But sometimes the resources are there, people just don't know how to get to them. And that's exactly the problem that a network of community health workers is trying to solve. They are trained lay health workers who can help folks get the care, the medication, and other resources they need to stay healthy. WKYT's Garrett Weimer spent a day with one of them to see how they are bridging the great health divide.
Kentucky Home Place. This is Sam. How are you?
From helping someone with their medicine,
Where do you go to the pharmacy at?
to getting them signed up for the Do Not Call list.
It's through a government website where you can just put in your cell phone number.
Being a community health worker
We'll just give them a call.
has a wide definition.
We're not limited to just health care. You know, if there's something that we don't do on a daily basis, you need the resources or the guidance, we'll be glad to help.
On the day we visited the Kentucky Home Place office in Beattyville, these chairs were empty.
Kentucky Home Place.
But Samantha Bowman stayed busy, filling out forms, making calls,
I'm doing good. Where's Mr. Rogers at?
answering questions to help her clients.
You have clients come into your office and they have been everywhere and can't get any help.
The pandemic has changed what her days are like.
There was so much about the unknown.
Fewer home visits, mailing masks, encouraging folks to get vaccinated.
They expect us to have the answers that they can't get from anywhere else and speak to them on a level that they understand.
It's also shown just how important these CHWs are
That's okay.
to those who depend on them.
Really, they're there to fill in the gap where programs don't really exist.
Kentucky Home Place is not the only organization with CHWs in the Commonwealth. It is, however, the largest and longest running, serving 30 eastern Kentucky counties.
They're just now processing your application.
CHWs go through training and are certified by the State Department for Public Health.
There's a lot of trust that's built up, and there's a lot of experience that these community health workers have.
They play a variety of roles, from insurance assisters
It's time for his renewal.
to nutrition and health educators, to helping folks get the medication they need, often insulin, or even things like glasses or food boxes.
Just little things, little minor things can help keep people out of the hospital, can help keep them well. And I think that's where community health workers come in.
We can call up there periodically and
For Bowman, it's personal.
it's not for everybody and it's not for the faint of heart.
Beattyville is her hometown.
It was in my blood. I knew I needed to do it too.
And she says her mother served as a community health worker here for a decade.
I'd actually sat on the other side of the desk. I came in to visit her one day and I was actually smoking. And she talked to me about smoking. Of course, I knew it was bad. I knew I didn't need to do it. And we talked about preventative stuff and she actually helped me get medication Chantix to help me quit.
Now she's the one serving as a resource,
Because he'll have to have it before the company will give him his medicine.
helping her neighbors get the resources they need.
I'll see you soon. Okay, bye-bye.
In Lee County, Garrett Weimer, WKYT.
And this year, Kentucky Home Place is adding 10 more community health workers. As part of that, they're hoping to expand to 3 new counties, McCrary, Montgomery, and Whitley.